This is Dr. Nick Rizzo from RingsideMedicine.com with Cases from Ringside Medicine, Eye of the Tiger. A 23-year-old pro MMA fighter presented for a pre-bout physical. A significant right eye abnormality was noted. On testing, he is completely blind in the right eye and admits to having a severe cataract from an injury from when he was a small child. His pro record is 6-1 as listed on the history form. He states that the last doctor cleared me and let me fight. I'm 6-1 as a pro. What was seen on an exam was a significant traumatic cataract with near complete opacification. Cataracts caused by blunt trauma classically form stellate or rosette-shaped posterior axial opacities that may be stable or progressive, whereas penetrating trauma with disruption of the lens capsule forms cortical changes that may remain focal if small or may progress rapidly to total cortical opacification. The information referenced here on traumatic cataracts is from Medscape. For the complete Medscape article, please click on the link to the lower left. Trauma is the leading cause of monocular blindness in people younger than 45 years. Annually, approximately 50,000 people are left unable to read a newsprint as a result of ocular trauma. Only 85% of patients who experience anterior segment injury reach a final visual acuity of 20/40 or better, whereas only 40% of patients with posterior segment injury reach this level. This case illustrates the concept of critical paired organs in sports. Historically, the best analogy was the high school football player with a single kidney. If a high school football player lost a kidney for whatever reason, he wasn't allowed to play contact sports again. And the thinking behind this was that the risk of losing the other kidney would be too great. Recently, this restriction has been rescinded, but the concept of critically paired organs remains quite relevant, especially for eyes in combat sports. The fighter was adamant about wanting to fight, not understanding why when a previous physician cleared him, why he couldn't fight at the present time. A distinction had to be made for the fighter between disability and disabled. Specifically, with one eye, he would be considered as having a disability, but if he lost both eyes, he would be disabled. If a fighter with a traumatic cataract has not had a complete ophthalmologic workup, they must be referred for SAME. And this is for two reasons. The first is to rule out other associated causes and ocular problems, the most common of which would be previous eye surgery, blindness due to glaucoma and retinal detachment, and other issues as listed here. The second is to evaluate if medical or surgical therapies would be appropriate. Thank you for listening to this presentation. This and other case studies are found at RingsideMedicine.com.